Hi, I'm Dr. Sedano, the Director of Clinical Support and Education at Vexia Diagnostics. Now, as you most likely know, small intestinal bacteria overgrowth, or SIBO for short, has been recognized as a medical condition for many years. Now, since the late 1990s, there has been a resurgence in SIBO research, which has been further enhanced by the increased knowledge of the GI microbiome and its role in human health and disease. Now, this research has linked SIBO to numerous health conditions such as irritable bowel syndrome, inflammatory bowel disease, systemic sclerosis, GI motility disorders, cirrhosis, fatty liver, and a wide variety of conditions. SIBO is typically defined as a clinical syndrome of gastrointestinal symptoms caused by the presence of an excess number of bacteria within the small intestines. The signs and symptoms of this condition typically arise from malabsorption of nutrients, alteration in intestinal permeability, gut inflammation, and immune activation in the gut. Now, some of the symptoms include nausea, bloating, flatulent, abdominal distension, abdominal cramping and pain, diarrhea, and constipation. And as you may know, these are very similar symptoms associated with irritable bowel syndrome. Now, in extreme cases of SIBO, signs and symptoms can include steatorrhea, weight loss, anemia, deficiencies of fat-soluble vitamins, and mucosal inflammation. Now, the recommended non-invasive test for assessing for SIBO is the breath test. Now, breath testing for hydrogen and methane has been used for decades in the diagnosis of digestive disorders of carbohydrate absorption, and more recently for SIBO. Now, this type of test is based on the principle that when bacteria in the intestine digest carbohydrates, they produce carbon dioxide, hydrogen, and methane. These gases will get absorbed into the bloodstream and then exhaled into the breath. Our lab partner, AllClear, utilizes a state-of-the-art gas chromatography analyzer that measures both hydrogen and methane concentrations very precisely. And all of the technicians at AllClear are trained by a board-certified gastroenterologist, and the lab test results are submitted to the gastroenterologist for review and final approval. I hope this information serves you and your patients well. Until next time, I wish you all the best personally and in practice.